Hello, my name is Chelsea Hayden, and this is my presentation of my leadership project proposal, Postpartum Car Seat Safety Resource Kit. Imagine it's discharge day for first-time parents just 48 hours after welcoming their newborn into the world. Morning assessments, vital signs, and medication rounds are complete, and the postpartum nurse checks in to confirm that the family has a car seat ready, hoping for a smooth and timely discharge. To her surprise, the father appears with the car seat still sealed in its box. With exhaustion and uncertainty written across his face, he admits, "We thought you'd be able to help us assemble and install it correctly." This common scene reveals a critical gap in postpartum care, one where well-intentioned families leave the hospital unaware that the car seat misuse poses one of the greatest risks to infant safety. Introduction. Car seat misuse and legal restrictions on nurses creates a significant challenge during the discharge process. While nurses are responsible for ensuring a safe transition home, they are legally prohibited from physically installing or adjusting a car seat, limiting their ability to guaranteed proper use. According to the Centers for Disease Control and Prevention, CDC 2022, a majority of car seats are used incorrectly in ways that could compromise infant safety during travel. The gap between caregiver confidence and actual safe practice underscores the urgent need for standardized education before discharge. Research supports the value of structured teaching in closing this gap. A study by Zhang et al. In 2021 found that a single one-hour workshop significantly improved caregiver knowledge and proper car seat use. Even brief, targeted education can transform how families understand and apply safety guidelines, especially when delivered by trusted nursing professionals. The desired outcomes of this project are threefold: to increase car seat safety for infants, to improve parent knowledge and comfort with correct use, and to establish clear, legally compliant guidelines for nurses providing education. Together, these outcomes address both the clinical and legal barriers that hinder effective discharge teaching. This proposal introduces the Car Seat Safety Resource Kit, an evidence-based intervention designed to standardize postpartum discharge education. The kit will include educational materials, hands-on demonstrations, and referrals to certified child passenger safety technicians, CPSTs, to reinforce learning and provide families with expert guidance. By equipping nurses with structured tools and clear boundaries, this initiative aims to enhance patient safety, empower caregivers, and ensure a safe start for every newborn leaving the hospital. Change theory. Rogers's diffusion of innovations theory, developed by Everett Rogers in 1963, provides a strong framework for guiding the adoption and long-term success of the Car Seat Safety Resource Kit in postpartum care. The theory's 5 stages, knowledge, persuasion, decision, implementation, and confirmation, align directly with the project's rollout. In the knowledge stage, nurses are introduced to the initiative and learn about the evidence supporting standardized car seat education. During persuasion, staff recognize how the kit enhances discharge safety and aligns with nursing standards. The decision stage involves trialing the kit within the unit, followed by implementation when nurses deliver education using printed materials, demonstrations, and referrals to CPSTs. Finally, in confirmation, positive feedback and improved parent confidence reinforce continued use. The project also reflects Rogers' 5 innovation attributes: relative advantage, compatibility, simplicity, trialability, and observability, which support buy-in and sustainability. By incorporating continuous evaluation, feedback, and reinforcement, the initiative follows Rogers' model for achieving long-term integration into standard practice and fostering a culture of safety and collaboration. Zhuo and Hong, 2024. Planned processes. Currently, postpartum nurses struggle to find a balance between educating parents on safe car seat installation and use while still avoiding legal liability. With Rogers' change process, resources will be available and integrated into postpartum discharge, closing the gap with parents and protecting families and nurses alike. Knowledge. The knowledge or first stage would last 1 month. The resource kit is thoroughly researched during this phase, and all resources, concepts, and hands-on materials are fully understood by the proposal leader. This phase includes proposal of the car seat safety resource kit, educational resources and materials available to staff and shared in staff meetings, posted flyers and leadership contact on unit visible to staff, base understanding of kit across staff with introduction to mannequins, demo car seats, QR codes, and documentation. Persuasion. Weeks 5 through 8 will get the team hands-on to persuade them through interactive workshops and discussions. Identify and educate nurse champions who are qualified and passionate about implementing the resource kit. Meetings held to train nurse champions and acclimate them into the change process. Begin to diffuse the information throughout the staff. Decision. The decision phase will be conducted in weeks 9 to 12 and involves implementation of the resource kit among nurse champions to identify the resource kit's strengths and weaknesses. Collect feedback from nurses and families. Parent surveys. Decide if the safety kit resource need to be revised or to continue with the change process. Implementation. Weeks 13 through 24 are the implementation phase when the change is adopted. Full rollout across the postpartum unit. Integrate education into discharge workflow. Mentor staff. Reevaluate weekly. Track parent confidence, nurse satisfaction, and compliance with safety documentation. Confirmation. Confirmation will begin in week 25 and continue indefinitely. During confirmation, positive feedback from staff and patients promote the continuous use of the innovation. The confirmation phase is ongoing due to the need to continually evaluate new data as well as the ever-changing dynamics of healthcare. Reevaluations at month 8 and 12 with auditing, EMR documentation to ensure the resource kit is being used and documented, parent surveys regarding the effects of the car seat safety resource kit on their knowledge level, perceived safety level, and accessibility of the information, unit managers conducting evaluations on use of car seat safety resource kit, continued periodic refresher courses for all staff and periodic full training sessions for new staff, recognize and celebrate staff with monthly success stories. Budget. The initiative represents a low-cost, high-value investment in infant safety, nursing education, and quality care. For less than $4,000, the Car Seat Safety Resource Kit provides the tools and training needed to reduce preventable injuries and enhance parent confidence at discharge. The training cost, $2,000, covers nurse education sessions, instructional manuals, and certified child passenger safety technician training component, ensuring staff are confident and competent in delivering standardized education. Materials, $1,160, include infant mannequins, demonstration car seats, and printed parent resources for hands-on learning and discharge reinforcement. Staff appreciation, $600, supports engagement and motivation through small milestone incentives, promoting ongoing participation and teamwork. Sourced from the hospital or departmental education budget, this modest investment directly supports QSEN safety competencies, magnet standards, and the hospital's mission of promoting family-centered care. The return on investment, safer discharges, empowered parents, and confident nurses far exceeds the minimal financial cost, making this project an invaluable addition to postpartum education. Discussion. The implementation of the Car Seat Resource Kit carries meaningful implications for patients, staff, and the organization as a whole. For parents, this initiative increases knowledge, confidence, and safety by providing consistent, hands-on education that empowers families to transport their newborn securely. For staff, it fosters professional growth, confidence, and teamwork by strengthening communication and collaboration during the discharge process. For the organization, it enhances overall quality, safety outcomes, and community trust, demonstrating the hospital's commitment to patient-centered care and excellence in education. Through the guidance of Rogers' diffusion of innovations theory, an approved budget, and a supportive nurse-led team, hospitals can close the gap in infant car seat safety education. This project demonstrates how a small, evidence-based initiative can create lasting improvements for patients, staff, and the organization, advancing safety, confidence, and quality care across postpartum services. Thank you very much.